Hello again, everyone. Thank you for watching my presentation. I want to give you a quick introduction on my topic, grief, whenever we have a patient that is facing imminent death. So a quick introduction is that most of us as psychotherapists will encounter at some point in our career a client who is facing an intimate death situation, which can be caused by many different ways. A few of these ways can be a terminal illness, an end of stage of cancer or heart failure or some other type of terminal illness, medical emergency, which could be some sort of trauma or trouble breathing, maybe even uncontrollable bleeding, even overdose. It could be alcohol, prescription pills, illicit drugs. It could be an accident, car crash, poisoning, falls, fires, and even natural disasters, which could be, someone is experiencing a hurricane, earthquake, tsunami, tornadoes, floods. We hear about wildfires all the time, and people are getting trapped in those wildfires. But the gravity is profound and very delicate for a counselor to work with clients who are dealing with such an issue where they need to be using a holistic approach when they're dealing with their clients. So just a little bit about what inspired me to focus on grief for my professional development project is I had an undergraduate course called Thanatology, or the study of death and dying, and I had to read a book called Tuesdays with Morrie by Mitch Albom. Well, Morrie was a sociology professor, and Mitch was actually his student back in the late 70s. Well, fast forward to the early 90s, Mitch heard about his old professor, Morrie, who was dying of ALS. At the time, Mitch's life was not going so well, his family nor his job. So he decided to reach out to Morrie once again just to reconnect. Well, whenever they reconnected, Morrie kind of convinced Mitch into sticking around and them continuing their lectures on those same Tuesdays that they had back in the 70s. And that was where they got Tuesdays with Morrie. And they, in fact, had about 14 more Tuesdays left before ALS took the life of Morrie. And during those 14 Tuesdays, Morrie focused on teaching Mitch a little bit more about life, death, love, and meaning. So he designed these lectures to help Mitch shift from his career-obsessed life to focus more on human connection and compassion. Really great book. So just a little bit of insight that Morrie was able to deliver through his memoir to me, and hopefully it will be good for any of us counselors, especially if we're dealing with a client who is faced with imminent death. Morrie, he explored grief by focusing on emotional honesty, the nature of loss, and moving forward with meaning. He desired embracing emotions rather than avoiding them. He also created a ritual called the morning cry. This is where he allowed himself to mourn any losses that he could think of and focus on the good things remaining in his life. So before his feet ever hit the ground, he was mourning whatever losses he could think of so that when he did get up out of the bed, he could focus the rest of the day on the good things that life had to offer him. Morrie once said, and this is what he was known for on page 82 if you have the book, once you learn how to die, you learn how to live. And I think that was very inspirational. Once you learn how to die, then you can learn how to live. So there are some benefits that I want to mention here. And the first one is counselors will be equipped with a deeper understanding of knowledge regarding the grief process of someone who is dying so that they can help the client face, accept, and cope with the inevitable. Counselors will also be able to identify what stage of grief the client is currently struggling in. And finally, the counselor will have the ability to explore what style of therapy will be most useful and identify the modality that will likely help improve the remainder of the client's outlook on life. So just a little of the integration process that we can hopefully apply this to our professional life so that we can help those clients out who may be facing something so tragic as the end of life. Counselors do not need to focus on the fix to prevent death. They've already been given that prognosis. It may be months or weeks, but it also could be hours or minutes. And in that case, we only have a limited amount of time to try to help them have a brighter outlook on life. But to enhance the dying client's quality of life is what we need to focus on by having emotional peace and meaning by focusing on their dignity, autonomy, and presence. Counselors need to emphasize a holistic approach by addressing the client's needs emotionally, psychologically, spiritually, and relationally. In fact, you may even need to collaborate with the medical teams, of course, after consent is given, if it is appropriate. Counselors will use empathy, humility, and comfort whenever difficult situations and conversations come around, and they will come around. And we will also explore practical approaches and therapeutic frameworks while experiencing self-awareness. We need to always have self-awareness and make sure we're not giving any type of counter-transference or being judgmental in any kind of way in our clients' lives and experience. So a few of the therapeutic modalities that I think comes out of Tuesdays with Morrie that I'm able to apply to my professional development is going to be client-centered therapy, existential therapy, acceptance and commitment therapy, narrative therapy, choice and reality therapy, and cognitive behavioral therapy, especially whenever we're dealing with a patient who is dealing and facing with imminent death. So I want to start off with client-centered therapy. I think this is one of the best modalities that we can use with someone who may find themselves in a difficult situation, because a lot of times they just want to be heard and seen and felt and validated. So client-centered therapy, it will prioritize their dignity, give them emotional safety, and it will allow them to expand on their own personal inner experiences rather than us trying to fix anything for them. We could also use existential therapy. It will help confront death with awareness, reduce fear through meaning, and live the remainder of their time with a greater set of authenticity and emotional clarity. Acceptance and commitment therapy. It will teach clients to stop fighting what they cannot control or change and make space for those painful emotions that they have to deal with and focus the remaining energy that they have onto things that still matter and give their life meaning. So I think ACT is going to be very helpful for these clients. Also, narrative therapy. It will help clients re-author their life story and preserve their identity and create meaning in the face of mortality. What better therapy to use than someone who has a lot of life regrets than to give them the ability to re-author their life stories and help them be able to face tomorrow. With choice and reality therapy, this will help the clients restore a sense of control, focus on present choices, and support meaningful actions and connections so that they can still choose their own behaviors even when facing death. This is still giving them that autonomy and ability to make decisions for themselves. And then finally, cognitive behavioral therapy. This is still the gold standard today in all areas and diagnoses, and it will help reduce distressful thoughts, build those coping skills for anxiety and depression, and support a sense of control and meaning for the client by how their thoughts, emotions, and behaviors all interact with each other. So just a quick summary with my topic on grief, facing death. Across all the modalities we just explored, counselors who are working with dying clients are essentially aiming towards the same set of goals, and that is going to be reducing suffering, preserving their dignity, and helping the person live productively and meaningfully during the remaining time that they have left. Each approach gets to the same core goal, just possibly in a different way. So my 10 minutes are up. I want to thank you all for your time and attention. I look forward to your feedback and reviewing your professional development presentation. And this is my reference page of my book and the other 6 therapeutic modalities that I mentioned. So my 7 sources here. And I want to wish all of you the best of luck throughout the remainder of this course. Have a good day.